Welcome back to Great Day. A lot of seniors are experiencing some anxiety with the deadline for Medicare enrollment approaching. Our next guest can remove the confusion and help you pick the plan that's right for you at no cost. Verda Health Plan of Texas is designed to help underserved ethnic communities. They offer solutions that are accessible, affordable, and culturally sensitive. Here with more on how you can get the most out of your Medicare are Dorothy Chan and Chris Bond with Verda Health Plan of Texas. Good morning.
Good morning.
Good morning.
All right, when I said a lot of seniors are experiencing some anxiety, both of you were like nodding. It's like, yes, because it is overwhelming.
Absolutely. Yeah. I mean, it actually can get confusing, and there's a lot going on. So, I mean, we're here to help.
Yeah, let's back up with, people have heard Medicare. Okay, Medicare, yeah, not for me until a certain time, but really explaining what it is and why you should take advantage of it.
Yeah, so Medicare is actually a federal health insurance program that it's offered to people who it's over 65. People who it's under 65 with disability, they also can qualify. So, it also depends on where you live, what county. So, these are all in the consideration to join.
Yeah. And the nice thing about open enrollment is we know that what you chose last year might not be what you need this year. Things change quickly. You might need prescriptions. You might need things for your eyes. You might need a certain specialist hearing, all that type of stuff. So Verda Health Plan of Texas, I mentioned that it addresses underserved communities. Take us deeper into that, because I think a lot of people don't realize that we have lots of folks here who are just in a little bit different category when we say underserved.
Yeah, I think for us, we, a strong group of professionals that have band together to create Verda Health Plan of Texas to form a health plan for Medicare beneficiaries that really focuses on getting to these communities, making sure that they have equitable access, and that it's fair for everybody that has Medicare benefits.
Yeah.
And so this is the opportunity to get in the community. We do a lot of sponsorships in the community, engagements with different centers of influence, whether it's senior centers or churches. This is where we try to make ourselves visible and create an opportunity to educate on Medicare.
Yeah, because, and some of those communities, the Asian American community, the Hispanic American community, the Arab American community, and I just want to, for clarification's sake, these are legal residents or citizens, right? Yeah. So that are eligible for Medicare. Fort Bend, Harris, Montgomery counties. One of those things you talk about of being able to be culturally sensitive can be the language, because it's hard enough to, it almost sounds like it's Greek to you when you're reading a lot of these Medicare plans anyway. But if someone has a language barrier, you can address that.
Absolutely. So, this is actually our niche, is we cater to the cultural and as well as language, because we know how hard it is for senior that, healthcare is already complicated enough,
right.
And especially for people who actually speak a second language could be a big challenge.
Yeah.
So all of our staff members actually speak a different language. We have in-house to speak Spanish, Vietnamese, Chinese, cater to our members.
Because from some of those countries, Medicare doesn't even exist.
Absolutely.
Right.
So you're starting from the beginning with some folks. But to show how detailed you can get, for example, the idea of bird's nest in a health program.
Yeah, so being culturally sensitive in our product design, our benefits that we offer. Bird's Nest is a benefit that's very popular in the Pan-Asian community. Mm-hmm. It's basically an alternative medicine, and it's nutritional. It's used for many different supplements, and so it's a very popular benefit to a lot of our Asian beneficiaries.
Yeah. All right. You offer a zero copay, and you're getting a lot out of that.
It's zero premium for the plan, zero copay for your primary care physician and specialist, which is, kind of standard for Medicare beneficiaries. I think one of the differentiators for Verda Health Plan this year is zero inpatient hospitalization copay.
Wow.
So if a beneficiary with Medicare goes into the hospital and they have Verda Health Plan, they're not going to pay anything for that hospitalization. And that's amazing peace of mind. In this economy, seniors have budgets, and we're really focused on cultural sensitivity and predictability and cost, and so.
Yeah, lab services, routine x-rays, you have tier 1 and 2 prescription drugs. We always say practice preventative medicine.
That's right.
But if you really did that, it's so expensive in a regular world, right? But with the Medicare here, you build that in because you know that to preventative care in the long run pays off. Yeah. All right, some unique features in the plans include one of the things that sets you apart, up to 60 hours of companionship, and we know that can be critical to quality of life.
That's right. We have certified folks that come into these Medicare, these members' homes, and will help with light custodial, things that they might need, play games, read to them, things of that nature. That social interaction is so important, and it also contributes to good health, right?
Yeah.
Mental health is just as important as physical health, so that's an amazing benefit. And yeah, you can get up to 60 hours depending on what you qualify of the two plans that we offer.
People can come in to give caretakers a break. You have
That's
the
right.
Silver and Fitness membership, grocery benefits, beauty spa, nutritional care, gas and utility, and unlimited transportation. One of the biggest selling points too is the maximum out-of-pocket can be $1,099.
Yeah, it's as low as $1,099. It goes back to that peace of mind that we were talking about. So even though there's a lot of zeros for the PCP, the primary care physician, or the specialist, and all of these things that you mentioned, if there is out-of-pocket, ambulance or something of that nature, it all counts towards that $1,099, which is the lowest MOOP of our two plans. And so that's the ceiling essentially of out-of-pocket that any senior would experience.
Yeah, some other things that you've got above and beyond. You have the Member Resource Center, which opened earlier this year.
Yeah.
Yes. So, again, our belief is we want to keep seniors or our member to be active, in order for them to meet with a social, circle with their friends. We're doing dance club. You were doing dancing class.
Dance classes. Y'all are going to get some marriages going on out there, right?
It's fun to see them come in the
Yes,
office.
absolutely.
You got game nights, painting classes, tea parties, again, bringing some joy into their life as well. All right, this time of year is ready, set, go. A lot of people think, oh, I'll get to it. December 7th is the deadline. I'll get to it. Get to it now, because you're going to get really busy in a week or so, and then forget about it. Don't forget about it, and don't let it just roll over, because there are some changes this year as well.
Yeah, that's what open enrollment is for, so that seniors can look at what options are available to them and make the best decision for their health, right?
Yeah.
Like you mentioned, our health changes every single year. We have folks in-house that are standing by to answer questions, do that needs assessment, determine maybe wants that they have. We're also contracted with certified professionals that do this needs assessment, understand those needs, make sure that we have their doctors, make sure we have their prescription drugs, and then try to give them all these additional benefits that are above and beyond, like you mentioned, grocery benefits, quarterly allowances for grocery and gas and utility bills. I mean, the list goes on and on.
And the price for walking them through it is
No,
free.
there's no cost for understanding that.
Yeah. Verda Health Plan of Texas has multilingual representatives, as we mentioned, ready to take your call right now and walk you through the process to get you enrolled. Remember, they offer $0 copay for a primary care physician, specialist, inpatient hospitalization, urgent care, and so much more. You can enroll now through December 7th by calling this number. It's 877-419-2730. Again, that number to call is 877-419-2730, or by visiting them online at verdahealthcare.com.